Good day to everyone joining us, and welcome to today's X Talks webinar. Today's talk is entitled COVID-19, Navigating the New Normal in Pharmaceutical Commercialization. My name is Sonia Hunt, and it's my pleasure to be your X Talks moderator for today. Today's webinar will run for approximately 60 minutes. This presentation includes a Q&A session with our speakers. This webinar is designed to be interactive, and webinars work best when you're involved. So please feel free to submit questions and comments for our speakers throughout the presentation using the questions chat box, and we'll try to attend to your questions during the Q&A session. Now, this chat box is located in the control panel, and that's found on the right-hand side of your screen. If you require assistance, please contact me at any time by sending me a message using that chat panel. At this time, all participants are in listen-only mode. Please note that this event will be recorded and made available to you for future streaming on xtalks.com. At this point, I'd like to thank Hurst-Bugal Consulting for this presentation. Hurst-Bugal Consulting specializes in pharmaceutical and biotech commercialization, helping clients with strategy through execution in 5 core service areas of new product planning, marketing, launch readiness, medical affairs, and market access. Hurst-Bugal Consulting offers integrative, tailored consulting services to meet your brand and business needs. Their diverse team brings experience from over 65 product launches, strategy and innovation leadership, and executional support for startup to large pharma clients. They have experience across a wide variety of therapeutic areas, including oncology, rare disease, metabolic disease, CNS, women's health, and others. And now it's my pleasure to introduce you to your speakers for today's event. And first, I'd like to introduce you to Brian Torres, Principal with Hurst-Bugal Consulting. Brian's strong strategic and client engagement skills enable him to lead complex projects and support senior clients with their most difficult business decisions. Brian practices a team-centric approach with a focus on building strong collaborative teams that can quickly flex to deliver on pressing clients' needs. He holds an MBA in pharmaceutical management from Temple University and a BS in biology from St. Joseph's University. And now it's my pleasure to introduce you to Brent Hurst-Bugal, President of Hurst-Bugal Consulting. As a 25-year pharmaceutical industry veteran, Brent brings his deep client-side experience and broad consulting expertise to all his projects. Brent has successfully developed Hurst-Bugal Consulting into a trusted partner for hundreds of clients since its founding in 2007. Hurst-Bugal Consulting has focused on product commercialization and expanded the core services over time while setting new standards to help clients succeed. And now it is my pleasure to pass over the controls and mic to our first speaker, and that is Brent. So Brent, when you are ready, you may begin.
Thanks, Sonia. I appreciate the introduction, and I think the controls need to go to Brian. Sonia?
Brian, you have the controls now. There you go.
All right, wonderful. Thanks everyone for joining. Looking forward to having a nice discussion here this morning and sharing our insights. You know, by now we've all been living through this COVID situation for 4 months, and we've seen a number of changes in those 4 months, and what we want to do is reflect on kind of where we are and give some of our insights as to how to best navigate the future, knowing that none of us have a crystal ball on this, but we'll give you our best shot at it, and we look forward to any questions you may have at the end. So the covers, what we're going to talk about here in the agenda is some industry trends with some up-to-date information that we wanted to kind of get everyone level set as to where the industry stands. We'll talk a bit about biopharma responses and then provide some of our recommendations. So starting off, really the key here is, as we all probably recognize at this point, is that as we've shifted really from this kind of initial crisis management, we're now into what I would call this middle phase, where we really need to look at medium and long range planning. And if you haven't done so already, we would recommend an immediate cross-functional review of the business impact, kind of for the short and through 2021, to really develop a game plan. The four things I'm going to talk about here in this section are the environmental challenges. Obviously, we're facing a decline in patient visits and reduced access to generate prescriptions. We'll talk about environmental evolution, which is the evolution of telemedicine and policy changes and what kind of short, medium, and long-term impact they may have. We'll talk a bit about payer responses thus far and what we predict the payer responses can be going forward into 2021. And last but not least, something that's near to our heart as we spend a lot of our time advising our clients on launch, we'll talk about commercial launch implications now and in the future. So in the first section here, I think we can all recognize that HCP engagement is really not expected to return to a pre-pandemic state for some time, and maybe not exactly ever. And some of the things we'll talk about here are obviously the uptick in virtual meetings. We've had a significant decline in-person and an uptick in telehealth, and we believe that will continue. 28% of physicians, as we see it, have indicated that this will have a lasting impact and probably a decreased willingness to see reps live. So that will change kind of some of the commercial model. There's a reallocation going on, and the patient volume may shift to different providers as coverage changes, going and the characteristics of physician practices changes going forward. We've also seen a varied response based on the specialization of the physicians, and we'll kind of show some information around that. And I think really importantly, in terms of operational and logistical issues, is that the effect of this is really different depending on the region and the location. And we'll show some data about what that looks like across the country. So I'll show, I've got about 6 or 7 kind of data slides here to go through. Some of this you may be familiar with, but this is really recent data as of just, the last week or so. And so when you think about it at the macro level, prescription generation decreased pretty significantly at the onset, mid-March of the shutdown. You can see here on the weekly numbers, things were down 8, 9, 10%. And that is slowly, and just really in June when things started to open back up again, that started to get back to the baseline, compared to year over year. July is a little bit of an aberration with the holiday week there, but it took, 2 or 3 months really to get back to the baseline. So those are prescriptions, that are kind of lost right now, and I'm sure that's affecting everyone's business. If we look at the next slide here, this really talks about the surge in telehealth appointments. You see the chart on the left, the blue bars show really the surge, what we've all seen and witnessed in terms of telehealth appointments, but a real drop off in in-person visits and institutional visits. And if you look at the right, that kind of shows it in a stack bar formation that we're still down below the baseline, right? When you think about institutional office and telehealth visits, we've just gotten back to about 80% of baseline. And so there's definitely a significant decrease here in the total volume of these visits that's going to impact our business. Kind of surprisingly, the productivity, kind of the new prescription productivity, has actually declined over the last couple months. And that's kind of interesting. And I think in that first surge in the telehealth, maybe there was some pent-up demand, but I know I didn't expect this, and I don't know if others would have expected kind of the prescription levels to slowly decline based on these telehealth appointments. And you'll see the difference in prescribing behavior, by physician type. I'm sure there's a number of reasons for that. It could be obviously the conditions that are being treated or the comfort with these particular physician specialties and prescribing online. But I think what's important here, obviously, is when you think about your business, you really need to think about your physician types and what's happening, in your neck of the woods, because it's different. There's not one pattern here for everyone. Next slide is, when you think about it again by physician type or by specialty, new prescriptions are still down substantially year over year by specialty type, which doesn't bode well if you've had a product that is, recently launched or you're planning to launch. I think the total prescriptions are kind of nearing normal for some of these specialties year over year. So again, the established brands with an established base of patients, they're finding a way to getting these prescription renewals, but the new prescription is down significantly, which is going to be challenging, obviously, as we kind of came into this thinking maybe this would only last for a few weeks or a month or a few months. But if you start projecting this out over longer periods of time, there's some serious kind of reforecasting that needs to take place. And when we think about, total details, have rebounded to about 70% of baseline, and the in-person details have started to climb back, and which is good. But you'll see here it also varies a bit by specialty, right? So we're kind of back up to 71% of baseline, which still doesn't give us that reach and frequency that I'm sure we were counting on, but at least it's climbed back to that. And if we go to the next slide here, and this is interesting here as well, because now we're into, to what extent have in-person details started to uptick, and we know that a lot of companies started to kind of get their sales forces back into the field kind of in the May-June timeframe, and we see that we're up to about 28% of baseline, but it does vary by specialty. And so here on the right, we'll see a chart by specialty. Obviously, oncology is got a low return, but they have a pretty high overall access because they have a high access from telemedicine and remote details. But I think again, this is important as you think about your business and your brands and your physician type, kind of where the access really sits for in-person detailing. And you might have a portfolio of products, obviously, that span across these different therapeutic areas. And then lastly, in this section here, I think what's really interesting is the difference in regional access here, because we've got a wide variety, and here's a skew of a number of kind of MSAs, and in some there's very little kind of access to in-person details, and in others it's back up to nearly 50%. And as of a few weeks ago, there were a number of MSAs that were actually above 50%, and those numbers are actually starting to decline again because of this kind of renewed surge, and in some cases kind of a backtracking on businesses being open. And so we may see this dip, and this is really important, when you're considering your commercial model and how to turn your sales force back on, and where you expect, kind of region by region, sales reps to have access. And so this really requires a lot of thoughtfulness when it comes to operational planning with the field forces. So those are some of the key data I wanted to share as in terms to kind of where everything stands right now. It may be kind of new information to folks, or at least more recent information, but I think if I were to net it out, clearly we had that first drop off and we've rebounded somewhat. We're not back to normal yet. We're looking potentially kind of sliding backwards in some cases in terms of access, and we're kind of finally making back up ground on total prescription volume, but new prescriptions are still down significantly year over year. Next slide, Brian.
Great. Thanks, Brent. I appreciate you walking through the data. I think it's really helpful to kind of color where the next couple slides will be talking through. And where we wanted to start is around customer journey. And I think everyone on this call has probably seen a customer journey and worked through it. But with COVID, everything has changed so quickly that many of our clients' journeys are now quite out of date. So we've grouped it into 3 sections. So prescribers, allied professionals, and patients. And then the next couple slides, we'll talk through a couple nice examples we've seen of how pharma is starting to pull telemedicine in and leverage it a bit more to define these. If you look at the prescribers, telemedicine is really changing the way that physicians are interacting with patients. And you're seeing a bit of a dichotomy between tech-savvy physicians who have very quickly embraced it and found how it works with their EMR or works with new platforms that they can bring in. And they're seeing a pretty nice conversation arc with their patients, versus some other physicians are really struggling where patients have longer wait times because the physician's trying to figure out how to get the telemedicine to work, or have abandoned telemedicine platforms and are just FaceTiming their patients, which you can think from a PHI or from a compliance perspective, I think there's some serious concerns there. So it's becoming a bit of a new normal with how prescribers are interacting with patients, which is creating some new opportunities for pharma and how pharma can help support physicians to be able to have these conversations in a different perspective and be able to still share resources and materials in a virtual world. Next is allied professionals, and pharmacist role has really changed. Like you think of traditionally more patients were going into a pharmacy and picking up their scripts, and now a lot of patients are going to the drive-through or trying to limit contact. But at the same time, pharmacists are now seeing the sicker patients in pharmacies where they're starting to do more COVID tests and treating, and their overall structure is changing a bit. And then from the patient perspective, patients are consumers just like everyone else, and they're concerned about being in person and going to visits and going to the pharmacy, and they're very much delaying any non-essential care. And their view towards telemedicine is a rapid uptake. I think something that should have taken 5 years has taken 5 weeks to start implementing and changing, which is really exciting, but a bit scary sometimes for how it's implemented. So from a partnership perspective, most companies are trying something at this point from a telemed perspective or in the process of thinking about it. 2 brands/companies that we thought were really interesting and wanted to bring to this conversation are what we have on the screen. The first is Contrave and their UpScriptHealth partnership, and the second is Bichaven and Cove. So I'll go into each one in the subsequent slides. For those of you who aren't familiar, Contrave is an anti-obesity medication for patients with a BMI of 30 plus or 27 plus with comorbidity. And they're partnering with UpScript, which is basically creating a hub light, if you will, for them, where you can see the flow on the right of the screen. On Contrave's brand page, there's a button that allows you to enroll or transition over to UpScript, and patients can log in. They answer a couple simple questions about their health and immediately have a physician consultation. That physician is able to write a script, process payment through the application, and then have a pharmacist dispense the product so it's delivered directly to the patient's doorstep. So it's the end-to-end seamless experience that many of the more complex rare disease oncology specialty products have been for a while. But this is a product that until relatively recently was not taking this type of a complex approach. One note is Contrave was a little bit ahead of the curve with doing this type of partnership, so they were starting telemedicine before COVID, but the amount of promotions and effort has definitely increased during COVID. Next, which is kind of interesting, is Bichaven and Cove. And Bichaven's actually able to work with Cove to allow a sign up, the consultation, the prescription ordering, et cetera, very similar to what Contrave did. But they're able to also have a collaboration where physicians can send information to patients. They're working through approaches to have their samples be able to be distributed, and this is in the CNS migraine perspective, to be able to really make it as seamless an experience as possible so it doesn't feel like you're behind a curtain. So if I move to the next slide, one of the sticking points for telemedicine historically has been reimbursement. And it's largely been a cash pay model where there's companies like Lemonade Health and others that make a very seamless and customer-centric approach, but you generally have to pay a $30 or $40 copay associated with it. And that's all it's cash out of pocket. That's not anything related to your insurance. And COVID's changing that a bit, where our market access team did a survey of payers within the last month or so and asked payers how they see COVID impacting their business in the short and long term. And I have a couple slides upcoming with some of those findings, but the key point here is that payers see this as a need to change, and they're not seeing it as a short-term impact. They're seeing this as a lasting shift that if it's able to provide care from physicians to patients and migrate site of care, they're happy about that, and they're looking to evolve policies to help cover that. Most notably, CMS has actually announced coverage of telemedicine beyond this immediate COVID support that they were historically given. So we like to kind of distill these thoughts and put out some best practices. We have a couple white papers that you'll see referenced at the bottom here. If you want to take a look later, you can definitely do so. But at a macro level, we've pictured a couple of best practices for those of you who are looking to get into telemedicine or understand how to support your customers slightly differently during this time frame. The first is really around understand what customers are doing today. Where are your physicians on their journeys with using telemedicine? How interested are your patients in actually going through telemedicine? There's definitely a difference in an oncology patient versus someone who's maybe in the derm space and doesn't think it's as necessary. So really remapping your customer experience, using that from your brand planning, your customer experience workshops is really important. As you start looking at your restart plans, as your annual brand plans, integrating telemedicine strategies into that, and that's again based on what your customers are doing today. And then aim for incremental iterations. I think this is one of those where oftentimes we see our clients try and get ahead of themselves and go from 0 to 100 in a series of weeks. This is one of those where small changes can make a big impact. It's better to make a couple minor adjustments and have it work really well, that seamless user experience, than to put something that's so complex you're creating friction points and losing customers throughout it. And then the where to play, how to win is how we usually like to think about these things, and having a strong business case to get everyone aligned on what this will look like. So even once you've done these steps, what is your business case? Why are you doing this? And then how should you actually build it? Does it make sense for you to be doing this yourself, or does this make sense for you to partner like you've seen some of our case studies on the previous couple slides do? And then define what comes next. So how are you able to support your customers? How are you able to ensure that seamless experience and really understand data and understand what's working, what's not, and continue to iterate over time? I think this is one of the really interesting points that is going to accelerate digital health. And as you look at spaces like diabetes, which are making large investments into remote patient monitoring, adherence tracking, digital connected devices, having all of those types of devices become even more important now. One really nice or salient example of that is we have a company who's launching a connected inhaler, and the connected inhaler is now becoming even more important because patients are able to communicate with their physicians and see that data in real time. So it's not the physician asking the patient, how are you doing anecdotally? They're able to share dosing, share other types of information associated with that as well. So to give you a break from us rambling on so much, we have our first poll question.
Thank you, Brian and Brent, for that. Yes, we have our first poll question. It's going to appear on your screen right now, and there it is. I'll give you 45 seconds to complete this poll question. Now, this is done in real time, so I will be able to share the results with you once I close the polls. So your participation is greatly appreciated. So please go ahead and cast your vote. And the question is, are you currently leveraging telemedicine tactics? And you have 3 options below. Please select one. Your first option is yes. The other one is no, but it's in the works. And their last option is not yet considering. So please go ahead and select one of the below. And then I will close the polls and share the results. And it looks like we have the majority of our members in the audience have cast their vote. So I thank you for those who have done so. And for those of you who have not, can you please go ahead and complete it now? I'll give you another 10 seconds, and then I will close the polls and share the results. Okay, thank you everyone for participating in that. I'm now going to close the polls and share the results. Okay, and the results from that last poll, which the question is, are you currently leveraging telemedicine tactics? We have 26% that said yes, 26% said no, but it's in the works, and 47% that said not yet considering. So thank you everyone for participating in that poll question. Now I return it back to Brian and Brent.
Thank you so much. And it's not surprising to hear the results. This is one of those things that's very challenging, and it's nice that more than half of you are starting to consider it or are currently doing it. So it's great to hear. So I mentioned a few slides back that we had done some payer research to really understand what's the impact of COVID on payers today, and more importantly, what are payers going to do about it, which is always difficult, and the answer is usually it depends. But to orient you to this slide, everything red is a force that's detrimental to a payer's budget. Everything in green is something that's beneficial to the payer's budget. So the first two are around COVID, and coming around initial COVID forecasts, the amount of care and the amount of costs and revenue that payers expected was actually overestimated relative to where COVID was for the first couple of months. So it was a lower than expected cost of care, and that's obviously impacting payers' budget. but at the same time, there's less elective care. So if you look at things like maybe a routine visit or a derm visit, or even something of getting your heart checked every couple of weeks for some of those patients who are on monitoring programs, there's a less elective claims, and there's significant impact to that, but positive because payers are paying for less elective claims. One detrimental piece here is rise in unemployment, and the rise in unemployment is causing a fall in premiums of commercial revenue, obviously. And what that's doing at the same time is increasing Medicaid and state exchanges. So as patients move from commercial to Medicaid, revenue from Medicaid and state exchanges is increasing. But there's been serious pressure downward based on 2021 premium increases, and the standard premium increases that payers had projected aren't as possible here. So the net here is a negative impact to payers' budget, which they expect to extend likely past 2022. From a lever or response perspective, that's probably the obvious next question you'd ask about. We've really identified 4 areas. And in the short term, there's limited flexibility due to state level regulations on premium increases and benefit designs, at least through 2022. So when we look at short term, we look at today through late 2021, and long term becomes 2022 and beyond. From a short term perspective, one of the first levers that we see payers pulling is really accelerating a shift towards pharmacy to management of medical benefit products. So anywhere it's possible to flip something over towards the pharmacy benefit, that's definitely an area that payers are looking at. Specialty pharmacy mandates and further reducing high cost of buy and bill practices is the second one. And the third one is just around site of care shift. So the idea of reducing drug cost administration in hospital outpatient systems, maybe incentivizing towards a sub-Q versus an IV option, really motivating to be socially distanced, and where home care or home nurses are available, those are definitely being encouraged as well. And the longer term would be those larger benefit designs where payers are able to restructure formularies, benefit designs to lower cost offerings with some of those pieces here. I do have a slide on short term and long term, and then a slide on key takeaways as well. So from each of these levers, if we dive into them a bit with implications, pharmacy oversight of office administered products, implications would be increased role of pharmacy expands scope of payers' ability to manage those specialty drugs, and economic impacts likely to lead to expansion in number of categories with pharmacy oversight of utilization management. So maybe those categories that hadn't necessarily been as tightly managed from utilization perspective are going to start becoming broader and more focused on. From a SP mandate perspective, it's really narrowing or limiting SP networks, may slow provider and patient access to office administered drugs. And brand teams really need to ensure, especially pharmacy network, is aligned with the networks that are mandated by the health plans, because there's going to be more pushback associated with that. And finally, as I mentioned earlier, self-administered products are going to gain value compared to some of those IV offerings. We actually have one client now who is working on an IV product that they're relaunching in a sub-Q formulation, and they had done a demand study a few months back and are now questioning those results and redoing demand study because they're starting to see a lot more interest in that sub-Q formulation of the product and are really starting to rethink about how much they're going to focus on some of these areas, because sub-Q is becoming so much more exciting to not just payers, but patients and physicians as well. From some of the long-term perspective, the benefit redesign, from the pharmacy side, it's increasingly narrow formularies, increase in high deductible plans, and payers outsourcing the formulary and utilization management functions. And the medical side, we mentioned earlier around expanded telehealth benefits, but also short-term out-of-network access allowances as well. And again, these are formulated by some of the payer responses and payer conversations we had. What the implications are increased pricing pressures, of course, and higher expectations for health economic benefits. So the value props and the health economics data is going to have to be even tighter for some of these pieces. Now, the question that comes out, at least for me, is what should biopharma do about it? And what are some of the areas that are going to impact biopharma the most. The first one here is around higher hurdles for patients and to access the specialty drugs. There's going to potentially be more steps, more prior auths, more challenges just to get on some of those specialty products, especially with reductions of formularies. Greater demand for patient copay support. I think this is one of those that has been very hot the last couple of years, and obviously copay is a much debated topic, but it will just continue to have pressures. And especially if you look at accumulators and you look at the shift towards maybe a voucher program that automatically applies. These are all things and tactics that are going to be very much the focus of pharma for the next couple of years. I mentioned earlier around the patient journey as telehealth expands and continuing to look at how that patient journey can be supported, but then look at how that data can be captured and shared and what the requirements will be from the payer side and what payer requirements will be on teledetails and what type of information has to be exchanged between patient and physician, et cetera. Shift in payer mix as Medicaid continues to grow, and growing role for employers as well as market access tactics. I do have one slide on employers, and then we'll get to our next poll questions. And employers are obviously facing some very significant challenges, such as their employees deferring non-essential care, the direct COVID costs associated with cost of care for their patients and any type of preventative testing, et cetera, and then the business impact that they're facing. And if you link the regional and segment specific impact on businesses with some of the slides Brent showed earlier in major metropolitan areas and the impact in some of those, you can almost correlate employers in areas that have been harder hit or that are being harder hit now are having broader impact, which is making it a really interesting area to focus on. And employers have a lot on their hands, so the ability to target and reach them can be a bit challenging right now. Types of how employers are starting to respond to this creates a really nice opportunity for the teams to be able to build those longer term relationships. Okay, so polling question number 2.
Okay, thank you very much, Brian. Yes, it's polling question number 2. I'm going to launch it right now. And there you see it in front of you. Just like we did for poll question number 1, I'll give you 45 seconds to complete this poll. And remember, this is done in real time, so your participation is greatly appreciated. And the question that we have for you is, what do you believe will be the most likely payer response to COVID? So please select one of the below. And your options are pharmacy oversight of office admin drugs, SP mandates, site of care shifts, or benefits redesigns. So please go ahead and cast your vote, and then I will close the polls and share the results. Okay, it looks like we have the majority of our members have done so. Looks we just have a couple more people. If you can go ahead and cast your vote, then I will be able to close the polls and share the results with everyone. Okay, so thank you everyone for voting. I'm now going to close the polls and share the results. Okay, so here's the results. What do you believe will be the most likely payer response to COVID? And we have 0% that said pharmacy oversight of office admin drugs, 5% at SP mandates, 26% at site of care shifts, and 68% at benefit redesigns. So thank you everyone for participating in that last poll. Now back to Brian and Brent.
Great. Thank you, Sonia. We're into the next section, really, which is about launch implications, right? So again, something that's near and dear to our heart as a firm that's helped our clients manage probably through 70 launches in the last few years alone. You know, one of the first things we thought of is, well, what is going to happen here? And when you think about firms that have recently launched in the last year or so, about 100 or so brands, firms that are, or brands that are preparing to launch this year, 50, and launching next year and beyond, 340. And in aggregate, the estimate, again, even from a couple months ago, was that this could have a negative $10 billion impact on launch products, and that number may be underestimated, given the prolonged effect maybe of getting back into physician offices or a second wave of COVID shutdowns. But there's a lot at stake, and I think everyone knows it's been through a product launch. I mean, this is the most challenging time, the most important time for a brand to get out of the gate strong. There are a lot of unknowns, obviously, until you get into the market. You can do a lot of planning, but until you get there, you don't really know exactly what's going to happen. and things have just become so complex now without knowing, when you think about the slides I showed earlier, what's my access going to be to these physicians? What's the access going to be relative to the regions of the country that are most important to me? What's the likelihood of a patient showing up to a physician? What's a physician's willingness by specialty type to prescribe a new therapeutic? These are so many questions that, as Brian mentioned earlier, around the patient journey that really just require a lot of extra thought, a lot of extra planning from the brand teams, and a lot more communication. And that's not even to account for the fact that our clients and all of us here are now working remote from each other, right? So usually in a launch situation, you've got all your key personnel parked in a war room somewhere, where communication between each other is super critical. The agility and flexibility of teams working together, you take that into account, and this has just gotten so much more complex. Now we have seen some of our clients, at the beginning of this, kind of delay their launches, but now knowing that that this may go on for a while, I don't think our clients are going to want to, kind of semi-permanently delay these launches. They're going to forge ahead, and they just need to do it in a different manner. So let's talk a little bit about what that might look like. If you take an immediate look at some recent launches, you'll see the effect here. And again, it's kind of early days, but everyone that's been in the industry for a while kind of knows that classic launch curve that says you get one crack at it, and you want that launch curve to look like a hockey stick. It's hard to rebound if you don't have it. When you look at these particular 6 or 7 launches in the last few months, these trend lines are either flat or flattening. And again, sometimes that's in a case-by-case basis. This is a relatively small N, but not super encouraging, on what lies ahead for the rest of us trying to launch products in this particular situation. So let's talk about what we might be able to do about that. On the next slide here, the things for 2020, if you're in the middle of a launch or you're planning for it, you've got it coming on, or you've just recently done it, clearly you need to evaluate the impact of all of this on the therapeutic area and really think about what level of unmet need you're facing, or your patients are facing, and what their willingness will be to kind of engage in those appointments and to get those prescriptions. Clearly a wide variation in local environments that we showed on that slide. And so when you think about your tactical plan and your mix between in-person and remote sessions, that really has to take into account field force agility and training. A lot of our clients quickly jumped into, well, let's at least train our sales force on how to engage remotely. And now I think we're at that point where we need to train them on how to really be a master at it, and maybe for the long term instead of just the short term. And what are the kinds of materials and tools that the sales force has been provided in order to do that effectively. It's not just enough to make contact on that Teams or Zoom call with your physicians now. You really have to be value added in terms of helping those physicians engage meaningfully with the patients if you're hoping to get those prescriptions. You think about incentive compensation and forecasting. Geez, incentive comp is challenging enough in the best of times to kind of get right across the nation, and particularly at a regional level when you think about access and frequency. Now is the time to be, very dynamic and very hands-on and very communicative with the sales force around how you're going to reconfigure incentive comp. The in-person visits versus remote visits, maybe these kind of slower uptake curves. What are you going to do to keep your sales force kind of engaged and motivated at this critical time? And obviously, targeted non-personal promotion. What does that look like? What do your customers value the most, and how to get it from a platform level engaged and optimized and kind of pulled through across the organization. So those are some kind of immediate needs if you're launching right now. There's obviously more than that, but it's really an all hands on deck kind of situation to get these right. If you're planning for a launch in 2021 or beyond, really the first order of the day is around scenario planning and risk mitigation, because there are a number of different scenarios that could play out between now and your launch. If your launch is 3 months from now, 6 months from now, 12 months from now, 18 months from now, it could be different, all of those things. And I think it's ongoing scenario planning that's kind of the order of the day. typically, you know, in our engagements, you do that scenario plan at the beginning, you update it as you go, but here it's going to be just more dynamic and more work towards risk mitigation. Something Brian talked about earlier was the patient journey and what's happening, you know, with the patients and the physicians and the payers. I think that is going to take a more continuous evaluation, you know, by the brand teams to kind of know what's happening at all times and to make adjustments. And that affects kind of that live versus virtual engagement mix. So it's going to be really thinking through that, picking good agency or vendor partnerships, looking at what's working, you know, taking the time to evaluate any data that has been generated this year in terms of what's been successful and to utilize that. So you're not kind of going into the blind like a lot of teams are having to do this year. And also, if you've got the time on your hands now, if you're 12 months from launch, you really need to think about alternative scientific communication pathways, because, you know, laying the groundwork with the scientific platform has always been important, but now it's all the more important, and you may have different and even better ways to kind of lay that groundwork now in this kind of remote environment, and having some access to physicians that you may not have had early on, in order to kind of make up for the fact that you may not get the access to them at the sales force at the time of launch. To be innovative with the engagement strategy, and most importantly, I think here is to continuously refine the forecasts and the targeting. And when I think about it from an organizational level, forecasts are always important to communicate kind of up and down the organization, to set expectations. You know, whether you're a smaller firm and it's your first commercial launch, and, you know, your forecast and timing is really critical relative to your financing, that's going to be really important to manage production forecasts. And whether you're a large organization having to report out, you know, earnings expectations and expenses on a monthly or quarterly basis, you know, you won't be able to use the forecast you had made a few months ago, and you probably have to continuously update it and just be honest with folks within the organization that that forecast may kind of change more frequently than before as things on the grounds evolve. So I think that's an very important element for our clients. So that's at a high level, you know, between kind of current, you know, this year and maybe the next year. But this is an area that you know, that we're continuously engaging with our clients and providing them, you know, insight and advice in this particular area. So I think we have another polling question coming up.
Yes, we do. Thank you very much, Brent. Yes, I'm going to launch that poll question right now, and there it is in front of you. Just like we did with the other poll questions, I'll give you 40 seconds for this one here to complete. And the question is, are you currently working on a product launch? So please select one of the below, and your options are yes, PDUFA in 2020, or yes, PDUFA in 2021, or yes, PDUFA in 2022 and beyond, or the last one is no. So please go ahead and cast your vote. Okay, it looks like everybody's on par with us here. Thank you so much, everyone, for voting. I'm now going to close the polls and go back to the presentation once I share the results. So I'm going to close the polls now and share the results. So here are the results for poll question number 3. Are you currently working on a product launch? And we have here 22% say yes for PDUFA in 2020, 11% said yes for PDUFA in 2021, and 22% saying yes at PDUFA in 2022 and beyond. And we have 44% that said no. So thank you, everyone, for participating in that last poll question. And now I return it to Brent and Brian.
Thank you. So moving on to the next section, and I will preface with the last 2 sections are quicker than the first, and because I recognize we have 14 minutes left. So the biopharm responses, given no company is alike, everyone is doing things slightly differently. We put together a bit of a 2x2 to kind of segment or archetype some of our clients and how we've seen. And the striding factors that we're using as the Y and the X axes are willingness to innovate. So it is how likely or how excited are you to be able to innovate, make investment, and have that strategic focus on new changes relative to COVID. Versus the X is internal capabilities. You could be as willing as possible, but are you able to do it? Do you have agility within your organization? Do you have the staffing, the structure, the data fluency, maybe even the connected partners to be able to pull in leverage as you go? We thought this is a really nice model, and as we start thinking of our clients, we can pretty easily put a few of our clients into different boxes, and it is a bit of a uniform view of where folks are. What we thought would be helpful is have a couple bullet points in each one to say, if you're in this box, what are some of the things you're starting to do? And this top left of high willingness but low internal capabilities is really where you're looking at a lot of partnerships. I think the companies that are that 26% of you who said yes, you're doing telemedicine, a fair amount of you might be relatively high on this willingness to innovate, and you may be either in this bucket or this bucket from a speed of innovation. So telemedicine, we're seeing a lot of maybe it's a COVID plan, maybe given internal capabilities or priorities or just the size of your organization, you're not able to do it at a brand level. So this is where maybe you have a COVID enterprise plan saying that above brand, there's senior leaders or a major task force that's really focused on what do we do to COVID? How do we relaunch? How do we redeploy our sales force? And it's really looking above therapeutic area, above brand at the enterprise level. As you then migrate, still staying in this high willingness to innovate, but as the internal capabilities increase a little bit, we're seeing those internal innovation teams, that COE who's able to work across. You're seeing COVID not just occur at the enterprise level that you have here, but you're seeing it at the brand planning level. So the annual brand plan process is potentially getting integrated. We're seeing a lot of our clients really completely update how they're approaching brand planning and are infusing a lot more insights from COVID, trying to have the ability to stay more agile and potentially change every month or every quarter, as opposed to setting a one-year brand plan for these types of areas. Then as you look at the willingness of innovation kind of going down, there's a fair amount of companies out there that are small or they have so many competing priorities right now that they're in that wait and see bucket. And they're being a little bit more reactive. They're looking at the IQVIA data or other pieces to say, what's everyone else doing? We'll go in based on that. Or they're looking at major trends and focusing a little bit more at the national level to be able to say, how are things going? They're probably then looking at the regional level and making the call based on regions, but not mining that data as much or having full dashboards showing all of it. Versus the fast followers, which is this bottom right quadrant, is probably where you have very strong CI and you say, listen, we want to do what some of the folks do up here, but we don't need to do that today. We can turn it on relatively quickly. We want to get some really nice insights from others. We want to understand not just at the national level, but all the way down to the regional and the account level data, who's performing, who's open, who's writing, where are our new scripts versus existing scripts changing, and how do we deploy tactics to be able to innovate or correct to make sure that we're able to deliver on our brand plans accordingly. So I know this was relatively quick. I feel like it's a nice framework to talk through, but this would have drained a lot of our time if we went through in more detail. So we're going to jump into recommendations, and I'll hand it over to Brent for this.
Right. So I think we've spoken about a number of these as we go along. It's kind of looking at, at this point, a scenario-based strategy and tactical review. If you haven't got it underway, we recommend you start it now. For those of you, especially even in brands that are kind of in market already, a short-term look at the implications between kind of now and the rest of the year. If you haven't, maybe at the enterprise level, established a restart team, or certainly at the brand or commercial level, we would recommend that. And that's really kind of a cross-functional team that says, how do we get everything back to where it was? I mean, this was certainly important a month or two ago before people put their field force back in there. But if you haven't kind of established that cross-functional team, we recommend it. Scenario planning, obviously, between now and the end of the year, there's a lot of variability still at play, and to reevaluate your patient support programs. For the medium term, a lot of our clients obviously are kind of in the strat planning and brand planning for next year. So it's incorporating kind of the insights and expectations for next year into your 2021 plan to refine your infrastructure and support for data-driven decision-making. That's really important to continuously get a data feed on a variety of factors and kind of load it into your expectations. And, since you're all working remotely, to rework internal processes and increase agility, because even that, there's a lot of unknowns around that, whether or not a large percentage of the client-side workforce will return in the fall, or whether that will even be further delayed, to the end of the year. On a longer term, you may be considering larger commercial model organizational changes, your redeployment of resources. I think that would be really important kind of at the higher level, the enterprise level, the C-suite level, to think about innovative areas and how you're going to accommodate these shifts in population policies and the customer journey, and really think about your long-term strategic plan. And that it's may definitely change the 3 to 5 year long-range planning for a lot of our clients. So these are the kinds of things I think that should all be happening kind of right now. And then, just on this start here, we kind of look at it as a restart playbook. If you don't have one already, we'd recommend that you jump into this so that your organization really is unified, and that you've got all these different cross-functional folks kind of aligned on these particular kind of areas of content. And I won't go too deep into it because of the timing, but you can kind of get the gist here of your daily mix of your engagement mix, your IC planning and field force planning, any kind of message evolution and data dashboarding that would be important, being prepared for second peak or second wave and maybe closures again in the fall and who knows into next year, and really to get your teams kind of empowered and agile and kind of unified as best you can. So these are kind of some of the key areas that we think are important, at the brand level or at the commercial level. I think we're up to the last poll question now.
So we are, and I'm going to do that very quickly as we only have a few minutes left and we want to squeeze in some of those questions from our audience. So here is the last poll question. How are you integrating COVID strategies into your planning? So please select one of the below: creating a COVID restart task force, rolling into annual planning, hybrid approach, or not involved. This is being handled at an enterprise level. So please go ahead and cast your votes. I'm going to make this a quick one so we can get into the Q&A. All right, looks like everyone knows what they want, that they've done it already. So thank you everyone for participating in that. I'm going to close the poll now and share the results. Okay, so here's the results of our last poll. How are you integrating COVID strategies into your planning? We have 7% creating a COVID restart task force, 20% rolling into annual planning, 20% at hybrid approach, and 53% not involved. This is being handled at an enterprise level. So thank you everyone for participating in that. And now I'm going to take over the controls and share my screen, and we're going to start the Q&A portion of the webinar. So if you haven't done so already, please go ahead and send in your comments or your question using the questions window as we start the Q&A portion of this webinar. And Brent and Brian, are you ready? Because I've got some here lined up.
Sure.
Okay, so here's our first one. Have you seen examples of sales uptick based on COVID? Do companies anticipate continued sales trajectory?
I can take that one. That's actually a really interesting question because it's not all negative news. And I think this is one of those where if you dive down into the therapeutic area and the patient type, we do have some clients who work in immunosuppressed patients. And in immunosuppressed patients, you're actually seeing the adherence on a monthly basis increase, where patients are very concerned that they're highly susceptible to this disease. And they're having refills exactly on time. They're being very compliant with their physician visits. They've shifted completely to telemedicine, but in that space, you're definitely seeing an uptick. And as far as anticipated future trajectory, it's tough to tell. I think more research would clearly be helpful in that area, but I would assume so, particularly given the uncertainty for how long COVID will last.
Okay, I'm going to go to the next question. The next question we have is, what do you recommend for companies looking to get into telemedicine?
Sure, I'll take that one as well. Telemedicine, like I mentioned earlier, can be challenging. It's one of those that requires multiple people to align internally. So it requires HCP, patient marketing, potentially the sales team, medical, market access. It's generally a little bit challenging to get something larger like that off the ground, which is why probably about half of you haven't started or haven't tried this yet. And this is one of those where having a strong understanding of your customer journey and building a business case that reflects directly to that customer journey is essential. So you can gain that internal alignment. And then also, like I mentioned, to be iterative with this and not try and go from nothing to having a fully functioning all bells and whistles. It's that smaller iterative approach to really make sure that this works.
Okay, here's our next question. We got a bunch of them here, so let's see how fast we can get through them. How should I get a better idea of potential payer response specific to my disease state?
It's really interesting. I'm glad someone asked that. So Dave Reese is our market access practice lead, and he's developed a really nice flash research tool that he's doing for a couple of our clients to really get a pulse of payers within their specific disease state. Because to the questionnaire, their question here, it's really specific, and it's not one size fits all for a payer response. It's going to be different. And in some categories, you're going to question how much you ask. Like if this is rare disease and you're not highly managed, do you want to start poking the bear or do you let this go? And I think this is where having a blinded flash research study is kind of very important. And it's also understanding what your team's hearing too. So beyond jumping directly to market research, what are your CAMs saying? Or what are your account reps who are talking to payers on an ongoing basis saying, and what are they understanding from their customers?
Okay, thank you, Brian. Here's the next question. Have you seen examples of product launches being delayed based on COVID?
Brent, do you want me to take that one?
Yeah, no, I can answer that one. We have, and in some cases early on, we saw some delays in the spring, pushed to the summer for full field launch when people felt like their field force would be back in. I think now most of what I've seen is that people are kind of still marching on with their launches planned for the fall. They're just kind of doing a little more scenario planning because at this point forward, it would be difficult to kind of predict when you should delay your launch to. So I think most people thought they'd give it the summer, come in the fall. But from here on out, I don't see a lot of folks kind of delaying it further because it's not any clearer in the future that it would be better than kind of in the fall.
Okay, thank you very much, Brent. Brian, did you want to add anything to that?
Nope, I think
Nope,
Brent
good. Okay, all right, let's go to the next one. Here's our next question. How have you seen annual brand planning evolve to incorporate COVID?
I'll take that one, Sonia. That's a good question. I think, what we've seen there is just people doing it, starting it earlier, engaging more effort, additional setup meetings and data analysis. Kind of that landscape assessment that everyone does just requires more effort now because people want to know what's happening kind of right now and doing some scenario planning. And there's a lot more focus on kind of regional targeting. So it's a lot of times you do this at the national level in your annual brand planning, but I think a lot of folks have broken it down regionally. And obviously just from a practical standpoint, because client teams aren't working together, physically, there's a much bigger shift towards remote workshops and using technology to facilitate the brand planning process, which is, like, again, usually an in-person process, but now it's remote. So those are some of the things I've seen. I don't know, Brian, if you have any other thoughts on that.
I think you covered it pretty well. And given that we have a minute left, maybe we take the last question.
Okay, all right, here we go. Are companies beginning to reevaluate their entire commercial model given the uncertainty of the COVID pandemic?
I'll take that one. In a nutshell, and given the time we have left, yes, there's been a lot of talk. And we've been privy, obviously, to some of it. I think a lot of it is still a little bit behind the scenes, but I know that a lot of clients at the outset, if they were considering changing their commercial model, now's an opportunity for them to really evaluate that and maybe expedite that. And for others, their business model they've all been affected. And so I think just about every organization is probably taking a look at it, and some are actually starting to forge ahead with planning it.
Okay, thank you very much. Woo, that was a speed round. So I just want to thank everyone for participating with those questions. We truly appreciate it. But that brings us to the end of the question and answer portion of this webinar. If we couldn't attend to your questions, the team at Hirschspiegel Consulting will follow up with you after this presentation. If you have any further questions, direct them to the email address that's on your screen. And there it is, info@hirschspiegel.com. Thank you everyone for participating in today's webinar. You will be receiving a follow-up email from X-Talks with access to the recorded archive of this event. A survey window will be popping up on your screen. Your participation is appreciated as it will help us to improve on our further webinars. Now, I'm about to send you a link in your chat box. You'll be able to view the recording of this event at that link and also share this link with your colleagues when they register for the recording as well. And get even more out of today's presentation by downloading the supporting materials available under the Handouts tab. So I encourage you to do that. Now, please join us in thanking our speakers, Brian Torres, Principal, and Brent Herspiegel, President, both with Herspiegel Consulting, for that very insightful and timely presentation. So thank you, gentlemen.
Thank you.
Thank you. It's a pleasure.
You're no problem. Thank you. We hope you found this webinar informative. It has been my pleasure to be your webinar moderator. On behalf of the team here at X-Talks, we thank you for joining us. I'm Sonia Hunt. Until next time, please take care and bye for now.